Do you mind? I'm gonna bring it all the way down to here, okay? Okay, perfect. Jeez. Good. My socks are lit today, though. Don't record it yet, though. It's literally like
lit.
Yeah, it's awesome, bro. I love it. Happy New Year, everybody. So what's going on with you? Thank you.
A lot of upper back pain,
Okay.
neck pain, like in my traps and next to my shoulder blades here.
Okay. Are you getting any of the numbness, tingling, anything going on? Sometimes.
Yeah.
Where's that? Where do you sense?
Usually down my arms.
All the way to the elbow, forearm?
Usually elbow, sometimes all the way down.
Just the left?
Mostly.
Okay. Anything in the fingers?
Not usually, no. Okay.
And then neck pain?
Yeah.
And then what do you do for a living? Like, is it more lifting? Do you sit? Okay. So obviously we're bending, hunching down, probably picking up phone calls. Like so you're probably favoring the left side if the problems are on the left side. Okay. So the symptoms, I just want to demonstrate this. Okay. I don't know if you've seen this before. This is more to scale the low back. Okay. But we have your vertebrae and your spinal cords in the back. Mm-hmm. Every level has a left and right nerve. And why do I ask where it's shooting or where do you feel it? Because every level has its own area. So if you're going down to here, it's one level. If it hits these fingers, it's another level. So if you're sitting and this is absorbing all the shock through time and a lot of stress, it could get weak. And this technically, if you think of it as a jelly donut, you start squeezing it or putting pressure, the jelly leaks out and it can put pressure on the nerve, okay? So the tight muscles can be attributed to that. It's because the joint, if it's supposed to move this freely and now it's kind of compressed and it's not moving the way it's gonna, the muscles will start getting upset and tightening up. So not only are we gonna loosen up your muscles today, we're also gonna stretch your spine, open it up, rehydrate everything, obviously that Y strap. So that's gonna open you right up because I know you got a nice flight coming up. So I wanna wish you luck with that, okay?
Thank you.
LA's not gonna be the same without you, but you know, come and visit.
I will.
All right.
For this.
Perfect. We're going to do some extra stuff for you, okay? We may start here. We'll do the stems, the muscle work, okay? I'll have probably Jason come and actually hit some trigger points, okay? Which will get rid of some of the headaches. And then I'm going to put you on our brand new Hill decompression table. Okay. So it's actually, instead of me 2-3 minutes doing with the Y strap, it's actually going to do it for like 15 minutes. Just pump your neck, okay? So maybe a little sore, but you're going to need it, okay? All right, sweetie.
Perfect.
You ready? I'm gonna lift. I'm gonna place the spasm first. Okay. So the ones that are in the center. Okay. So I'm gonna place one here. Okay. I'm gonna place one right here. Am I placing them in the right spots?
Yeah.
Okay.
Yeah, it's right along this, between the spine and shoulder blades.
And then you're going to also have some on the upper traps as well. Another one, diagonally, I'm gonna lift and place down here, right on the paraspinal. It's gonna be right here, okay? You took that like a champ. These are really, really cold. So, and cold. You didn't even flinch. 4, spasm 3 and 4. You let me know how you're feeling, okay? Okay. I'm gonna start slowly. If you feel any pain, let me know. Okay. Whenever you feel it's strong enough to stop me, okay? Okay. So far, so good?
Yeah.
Should I go more?
Yeah. I don't feel anything.
Let me know. Feel it?
Mm-hmm.
Perfect. Perfect, perfect. All right. So this is gonna go for about 10 to 12 minutes.
Okay.
And now we're gonna turn on directly on the top where you're feeling pain. You should feel just a very slight warmth. You shouldn't be feeling like it's burning you.
Okay.
I am gonna come in and check on you in a couple minutes to make sure that everything is still comfortable, okay?
Perfect.
And for now, just lay back, relax, and take a nice 10-minute nap.
Thank you.
All right, I'll be back.
Are your joints hypermobile too?
Yes.
Okay. Yay. got a wider table. Relax, relax. Okay, breathe in. All the way out, drop. Do you not usually pop like this? Y strap, right?
Yeah.
That's what gets you. Okay. Still gonna try it. Breathe in. All the way out. Drop, shoulders back. Okay. That just means more for the Y strap.
Perfect.
Okay. Oof. You guys don't hear that, but her hip completely popped back in. Let go of this right here. Drop. Good. Let's go on this side.
Face this way?
Yeah. Last thing you want is this thing to stretch. Okay. Relax, perfect. Okay. Chiropractors don't like flexible patients because their joints are much harder to lock. So our approach is different. Breathe in. Hold on. This is gonna. There we go. Breathe in. Out. Jesus.
Yeah. Would that hurt more?
Oh shit! Dang. That's another term for popping off the new year. Jesus Christ. But for you chiros out there, any gymnasts, dancers, kind of have to put them a little more in the rotation before setting up, okay? Just to get that extra distraction.
And I wasn't a gymnast or dancer.
Yeah, some people just born hypermobile. Ooh, got the wrist too. And guys, before you comment stupid stuff, please be respectful. Thank you.
Thank you.
Jesus Christ. Okay. Yeah, the stuff I read is like, don't even respond anymore. Breathe in, out. Right there, breathe.
Ooh.
Yep.
That was the whole sign.
We got it. Just really have to lock you out. All right, let's go face down. Skin calf coming up. Let's do it. Huh? You all right?
Yeah, I was stuck.
You want me to readjust it?
No,
It didn't pop. All right, we're good. Dude, your low back just. It's the best we've got, I think, so far.
Good.
All right, so do you mind? I'm going to bring it all the way down to here, okay? Okay, perfect. Jeez. Good. Perfect.
Perfect.
Let me just move. There we go. Just want to open up the rib cage. There we go. Drop your shoulders down. So not everyone responds better to the P to A or A to P. Breathe in, all the way out. Good. All right, let's scoot face up again. We're gonna do the axial traction, and I decided to do this first because once I adjust in the axial axis, when we do the actual heel decompression, the joints and spine will be in a more optimal position and she'll get a better result. Let's go down. Let me actually remove this. Is this your first time getting it with this?
Yeah.
Not the Y strap? Mm-hmm. Okay. Earrings were good. Okay. Just let me know if it's choking, but I'll do my best to just grab right under the chin, okay, abs? Okay. And this is how we send off people in LA. How's that? Comfortable? Mm-hmm. Deep breath in. All the way out. We good? Thumbs up or down? Perfect. Keep breathing. Breathe in. Out. Out.
Oh my God.
Jesus.
Oh my God.
Hello.
Shit.
It's okay. Let it out. It's okay. Don't hold back.
That felt amazing.
Jesus. You got the low back. I'm sorry. I'm getting choked up here. That adjustment was lit. Literally. Hold on. Your lights just went on. I'm telling you, dude. Yeah, that was great.
I felt that all the way down.
I wish everyone could experience it. You know, the microphone doesn't catch the, you know, it's like an accordion, right?
It was.
I wish I was you. All right.
That's amazing.
Awesome, Abby. All right, we'll get your neck decompressed and ready to take on 2024.
Yes.
All right.
Let's do it.
Dude.
That was crazy.
Dude. Yeah.
That was crazy.
I told you. That's how I know once we do the Graston.
Just loosens everything.
I just knew you were going to get the best result. All right. See you in a minute.
All right. Hi, everyone. My name is Abby. I've been coming to Dr. Rafi for a couple months now. And let me tell you, he's insane. He's so good at what he does. He really knows what he's doing. He's been helping so much with my upper back pain. I have a lot of muscle tension, muscle spasms. I leave these appointments feeling so relieved. We just did the Y strap thing. Let me tell you, I can hear sounds. That's normal to hear sounds. I can hear colors now after that. See, I can't even think straight. English is not computing in my brain. But seriously, he's amazing. He helps me so much with my pain, and you should come to Dr. Rafi.
Unleash the Kraken.
Oh!
Welcome back.
Honestly, that's the best one. I can't.
Let it out.
I know, it's
It's your
so
body
good, that
resetting. There
I
you go.
know, it's like... Okay.
Yeah. Everyone is dreading going back to school after a break. All right, let's go. Face up. What's bugging you?
I don't know, always my hips are missing.
Okay. And then sacral. All right. We'll figure it out. Let's just get your hands too.
Oh. What's happening?
You're getting adjusted.
That's a lot of crying.
Unleash the Kraken. Give yourself a hug. This doesn't hurt, does it?
No.
Okay. Breathe in. All the way out. Drop shoulders back. It's all good. Yeah, we have a hard time getting you adjusted this way. Breathe in. Out. Drop shoulders back. Breathe in. All the way out. Drop this shoulder back. But there it is.
Am I crooked?
A little bit.
Yeah.
You want to be a chiropractor when you grow up? No? Okay. Smart man. Breathe in. Out. Relax the hip. Drop, drop, drop. Let it go. Good.
Oh.
Good. Let's go on this side. Face me. What was your favorite part of Vietnam? Did you ride an elephant or something? No? Yeah?
The massages.
What kind of massage?
Full
Foot?
body.
Oh, nice.
We did elephants in
Oh.
China. That was nice.
Yeah, a lot of people going to Asia.
Actually, when we were in Thailand, we went to a rescue. A baby elephant was in the ocean with him, playing with him, tickling him. It was like the coolest experience ever. Cause
Bigger than you though, right?
It's
Pretty
like-
big. Elephants go through pregnancy for 2 years.
Oh my god.
Yeah, their pregnancy is 2 years.
Elephants see humans like the way humans see puppies. So
Good
the
to know.
elephant was playing with him like a little like puppy.
Unleash the Kraken, baby. Good. Perfect. Other side.
What movie is that from? Hold on.
What do you mean?
The Kraken.
Kraken.
Mason, what's the Kraken from?
Teenage Kraken song.
Okay.
From like, I don't know. Disney?
Yep. Oof.
Hi.
Jeez.
I have carpal tunnel.
Oh. We all have carpal tunnel. You have carpal tunnel syndrome. Right, one more.
What?
Carpal tunnel. Oh,
Yep.
feels so weird.
Carpal tunnel syndrome, buddy.
I got it from pregnancy.
It happens.
What is that?
I'll explain in a bit, okay? Breathe in. Out. Nice. Perfect. All right, let's go down. Just a little bit. Perfect. Right there. Lift up.
In your wrist?
Nicholas?
No.
Spaß. I think you'll be fine.
Okay.
Hangi estás?
Yes.
Perfect. All right. Out. Beautiful. Keep breathing in. Breathe in. Out. And let's unleash the Kraken. Welcome back.
Honestly, that's the best one. I can't.
Let it out.
I know it's
It's your
so good,
body
that one.
resetting. There
I
you go.
know it's like. Okay,
Yeah.
I'm good. Oh, thank you.
You're welcome. There we go. Just a little bit. Ready?
No.
Hold on. Okay. I am gonna lower this up to here, okay?
Okay.
You ready?
No. Yes. Yes. Okay.
Yeah. Good. Perfect. Wasn't too bad. All right.
Am I not straight?
No. Scoot this way again, just to make sure.
Which
On
way?
your side, face me.
Face you?
Yeah. If not, it's extension on the other side. But let me just. You're off by like a few millimeters. Relax. No, it's not here. Yeah, other side. Extension. Okay. Relax, relax. It's not.
Maybe my hips. When you do the. I forgot what it's called.
Total. Did your hips not go? Relax, let it go. Too tight. All right, Mace, let's have Mama sit there. Want me to say unleash the Kraken? Yeah? She adjusts good, but gotta be patient because she always tenses up. So
Me? Yeah.
yeah, we gotta find a way to distract you. Ready?
Yeah, because I'm a nervous person.
Don't worry. Ready? Good. Let me just see what's going on. Jeez. Okay. Good. Just drop your left shoulder.
Which one's left though?
That one. The other left.
This one?
Unleash the Kraken.
Oh!
Here we go.
Fatality.
No, we don't want to say that. Fatality. No. It's more like thank you. I feel great. I'm gonna go home, drink a lot of water, get a good night's sleep. Welcome back to America. Ready? It's a Mortal Kombat. It's a guy thing.
I play with it.
Get over here. All right, you ready?
Yes.
I wish we could record like the kids' reactions when we adjust the parents.
Right.
Ready? Okay, relax. Let it go. Good. Yeah, you're definitely not getting any sleep.
No.
Both.
Yeah.
Okay. You want me to unleash it again? Unleash the Kraken. Drop your shoulder.
Oh! Oh! I didn't expect that one so
Oh, this is actually,
It'll kill.
we got good old MLK quote here.
What is it?
The time is right to do what is right.
I have a heart.
We heart chiropractic and MLK.
There you go.
There you go. That's how you end the day. Unleashing the Kraken. What up, Mace? I feel so much better now.
Yeah?
You feel better?
Oh my God.
Drop your shoulder. Left shoulder. Unleash the Kraken, baby.
Oh. Wow.
Yeah.
Woo. Yeah.
Sweating is good, right? It's releasing all the nerves. The nerves are starting to fiber, so sweating is good. Awesome. Breathe in. All right, we're gonna get the joints you sit on out. There it is. Yep. And this. Drop the right shoulder. Baby one. Yeah. We're gonna hook her up. How'd you feel after last?
So good.
Love Kanar.
Yeah.
You want me to do your toes too?
Like take off my shoes?
Yeah, but your socks could stay. It's up to you.
Whatever you want.
Okay.
Whatever you want to do.
Okay. Should have kept this on for now. Ready?
Yeah.
You all right?
Yes. You?
Good. She's ready. This is how you take on Mondays. Get the full. One hand at a time. One hand at a All right. So there's some patients. State of wellness. They come in for weekly adjustments. Here you go. There you go. John, not John. All right. Put this here so you guys can hear it. Okay. Give yourself a hug. Does that hurt?
No.
Is that better? Or like this?
No, other way.
Just relax. Breathe in. All the way out. Okay. One more. Out. Drop shoulders back. Oh, there it is. Okay, scoot down a little bit. Relax your neck. This is where most of our issues are. All right, in there. Breathe in and look straight. All the way out. Look straight. Drop shoulders back. Jesus Christ. Worse than usual. I know. We're gonna get it with the R strap. Don't worry. Jest wam ściągnę kiss. All right. Toes?
Sure.
You're welcome. Make sure there's no holes in the socks, you know. Everyone's worried. Good. Yep. Oh, your hip's gonna go. Yeah. You did something this weekend. Something fun, but you're hurting now. Oh. Oh, jeez. That was pretty good.
Yeah.
Unleash the Kraken on that one. And let's get the ankle. I'm glad he's not recording like a close-up of your...
Yeah,
Let's go on this side. Dude, your ankles needed it.
Where?
On your side, face me. Okay, perfect. Bottom leg straight. We just scoot towards me a little bit. Perfect. Bottom leg straight. Okay. Hangi stes? Perfect. Relax. Good. Straight, straight, straight. Bottom leg straight. Perfect. Awesome. Breathe in. All right, we're gonna get the joints you sit on out. There it is. Yep. Jesus Christ. In 1 week.
I know.
Whew. All right, let's go. Other side, yeah. Girl.
I don't know. I don't know what the hell I did.
Okay. Hangi stes. All right, let's get. actually. Yep. All right. Breathe in. All the way out. Good. Good. John, not John. All right, let's scoot a little down. This is the money shot right here. Let's see the earrings. You're okay with those? Good. Let's go down. You're okay. I'm gonna lift this up. Yeah. I'll make it chill better, actually. Make sure, yeah, there we go. Hangi stas? Okay. You. Comfortable? All right. Deep breaths in. Out. Keep breathing. Out. Keep breathing. Out. Good. Deep breath in. All the way out.
Oh my God. Oh my God. Woo!
Okay. Unleash the
Oh my
Kraken.
God.
I have to
Wow.
after this.
Yeah. Jesus
Yeah,
Christ.
I knew I didn't want to tell you, but when I couldn't get your upper back, I'm like, dude, this white strap is gonna go
Okay.
all the way to her tailbone, pretty much.
Can I wear my
Or
shoes?
not? Yeah, you can wear them.
Oh.
Here, have a seat here. Give your leg.
Okay.
Right, you want me to keep doing it?
Oh.
I need like a team to experience.
Sorry.
No, it's all good.
Okay.
At least you're wearing the Yeezys.
Whew.
She got cool socks for this occasion too. Like skulls and roses.
Wow. And you're matching.
Yeah,
Navy
I always
navy.
have to match. There we go.
Nice.
You ready?
Yeah.
Alright, sling that acrylics. Do you want it here or on me? It's perfect over there. I'm gonna try not to grab it. 'Cause drop your shoulder. Left shoulder. Unleash the Kraken, baby.
Oh. Wow.
Yeah.
Woo. Yeah.
Sweating is good, right? It's releasing all the nerves. The nerves are starting to fiber, so sweating is good. You don't know what to expect when you unleash the Kraken,
I
baby.
know.
Alright. You have a couple. Okay, let me get this upper.
Oh.
You want me to do level by level?
Sure. Oh.
Oh, this is gonna pop too. Yeah. Okay. You like it like this or all at once?
No, not. Doesn't matter.
Drop. Lean back. And this. Drop that shoulder. Baby one.
Ow.
So sometimes if it's not mobilizing, you try to thrust. You don't necessarily have to continue doing it. It's just a sign of tight muscles. Kind of just shock it a little right here. Breathe in. Is that shooting anywhere?
Yeah, everywhere.
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 Yeah, so we're just gonna hold it. Like my other video, it's a nasty trigger point. Drop your right shoulder. Good. People ask me how often do I work out? I don't. It's all just chiropractic. Okay, let me pop the shoulder.
Okay.
You need a minute? You're good.
Okay, we're good.
Cup your ear. Let it go. Let it go. Okay. There we go. Let's do this left one. Let it go.
Thank you.
Ready to take on the week?
Yeah.
I'll spell
I will.
Thank you.
Thank you.
I got cool socks, by the way, which I'm very hungry. I wish I worked today. If you could read this, bring me some pizza. So pretend I'm wearing this, everybody. I'll be at Sherman Oaks tomorrow.
I feel great. I feel more relaxed. He's amazing. He's a really good chiropractor, and he's always so welcoming, and he's super sweet. But thanks, Rafi.
Breathe in, out.
There it is.
Dude,
There it is.
both sides, every level.
I know.
What's wrong
Every
with you?
time.
That's it. You're like a chiropractor's dream. Yeah, before her flight, I thought it would be a good idea to get her in here. So this is day 2. So the video you guys saw was recorded 2 days ago. Perfect. And then let's get your just don't. So I just want you to see the Graston and how it develops. So when I say do not, usually do this when you have to wear a wedding gown or stuff like that. You may have this bruising, but it's a good thing, okay? With bruising, you get repair, all right? So what's going on now is there's swelling to immobilize this area, and then the histamine, and when blood flow comes to the area, the repair starts. So what is happening is now they're gonna lay healthy, fresh, new fibers in that segment, okay? So usually around day 4 is when I tell patients you're actually gonna be like, oh my God, I see it now. So Abby, if you don't mind just saying a few quick things to let patients know what you're experiencing.
For sure. So definitely some soreness, which is totally normal. I expected that, of course. But I can feel it's a lot looser. It's a lot more flexible, comfortable. I don't feel as much tight pain. Of course, it's like tender and sore, but totally doable for the next couple days. And I already noticed improvement.
Perfect.
Yeah.
All right, let's get to it. So we're just
Let's
gonna
get to
adjust her and wish her health, love, prosperity in this next journey in her life. All right, she's been a big supporter of the clinic. We're gonna miss her, but if you're ever in LA,
I'll
if
come
I find
back.
out you're not coming to visit us, I won't be mad. Abs.
I'll come back just for this.
There you
Don't
go.
worry.
Let's go face up, Ab. Relax.
Okay.
Yeah, you're fine. Breathe in. All the way out. Drop. Good. Breathe in. All the way out. Drop. Shoulder. In. Squeeze that. Perfect. This is where, right in here. Okay. Breathe in. All the way out. Drop your shoulder back. Got it. Okay. This is a rib. Flexible.
That was good.
Yeah, you're right. You can think. You are hyperextensive joints, like your elbow.
I know.
Oh, you didn't catch that? Go here.
Ooh.
Hey, well, I
I
practice
did that
on
too.
myself.
I get-
Well,
Oh,
there
I
you
did
go.
it.
Go, just do it for me.
Accident.
Oh, didn't
This
work.
would never
That would have
be-
been
it
cool.
would
It would have been like a good.
Dang.
That could be cool one for May 4th for Jedi stuff. With
Yeah,
our
May
outfit.
4th.
Remind me. This is how content is created.
Yes.
Good. Jeez. One more. There you go. All right. Oh, there it is.
Oh, there it is.
Let's go with this. Breathe in. Out.
There it is.
Dude,
There it is.
both sides, every level.
I know.
What's wrong
Every
with you?
time.
That's it. You're like a chiropractor's dream, bro. Like the easy
What I'm
pump.
here for.
Thank you, Gabs. Appreciate it. You don't like seafood, huh?
No.
Oh, nice.
Nasty.
It's all cons for you right now.
Mm-hmm. Exactly.
Breathe in. Out. Every time.
Silence.
That's it.
Silence in my body. Feels amazing.
Thank you.
Feels amazing.
I just want to whisper because I know you're relaxed now. Yeah. All right. Good night.
I can hear colors.
Someone said the taste in my mouth changed.
Mine is like hearing. Like all of a sudden it's just like clear.
Is it really?
Yeah, I don't know what that
You get
is.
ringing in the ears?
Not really, no.
Okay. Okay. I had a guy fall asleep yesterday, and he was
Really?
like, "Dude, it's lunchtime. Please sleep," because he does day or cryptocurrency, so he doesn't sleep because there's no open and close. It's always there. Okay. Beautiful. Okay. Okay, sorry that one.
Interesting.
Yeah. So she is going to be hypermobile, no surprise there. Oh, you are tight up there. Good. Relax, let it go. Good. She doesn't want to get out of LA. Drop your shoulder, right shoulder.
There it is.
There it is, boo-boo. Ready for this one? I know you have the piercings, but
Yeah.
okay.
Weird.
Yeah, it's your eardrum. It's 3 bones, right?
Sure.
Malleus, incus, stapes. If it's a joint, if your chiropractor is good enough, they could adjust it. Drop your left shoulder, unleash the kraken. There we go. Good luck on your journey.
Thank you.
Enjoy that one.
Thanks. I don't think I'll need them in Maryland, don't worry.
Drop your right shoulder. Left. Good. Okay, and let's flex forward. Okay, this will isolate the levator right in there. Okay, swelling right in there. So I know we're gonna get it in your hair,
Okay.
but this right here is completely spasmed out. Yep. Okay. And I tell my female patients, especially if they have like birthday parties or weddings where they're going to wear dresses that are going to have the back or the neck area exposed. So this is really jacked up right here, abs. Okay.
Perfect.
Yeah.
Remember I showed you my MRI?
Yeah.
It was all up in like
Uppers.
Yeah, yeah.
Jeez, this thing is, and the redder it gets, the faster it gets red, the more injured that area is. So this is worse than this actually. Let's flex forward. You see this one? This can lead to like pain in the eye region. Jeez, you're doing great, by the way. All right.
Yeah.
All right, I'm gonna give that area a break. Okay.
Okay.
Now let's take your arm, give yourself like a hug. Okay. So that distracts or takes the scapula more lateral, exposing this region a lot more. So we're gonna get this part of the upper trap. And wow, do you hear all that? Mm-hmm. That should not be there. That's not healthy. Okay,
good.
all that means scar tissue. Yay, abs.
Yay. Doing great.
Okay. Nice. Beautiful. Well, for me, sorry. This is what we want, is what I mean. Okay. All right, let me just get this. And this is nice because we can really.
Tell me what you're gonna do. Show me.
Well, I need you to lean back,
Okay.
relax, say hi to the camera, tell everyone your name and your handle or whatever it's called.
Hi, my name is Lucy Hart. I'm a permanent makeup artist and I specialize in eyebrows and microblading.
And I'm Dr. Rafi Guregian. I specialize in unleashing the Kraken. Okay. Okay. She is so nervous. I got you. Just relax, relax. Good. All right. So see how this is not moving, okay? So I need you to lean back. All right. You once?
Yeah.
Lucy, this is Galil, Lucy. She's in like the beauty industry. She does micro needling. I think my sister took a course. I think so. Anyways.
Oh my God, is that your sister?
Skin
The one that does the fibroblast now?
Yeah. Of course.
Aw, okay,
Yeah, and my mom came to you. Angela, but she had oily skin. 2 minutes, but it's okay. It's okay. Chekhov. Okay.
So sad.
No, it's okay. It's not for everyone, right? But she was happy with the care. All right. So how do you want us to go about this? Just okay. So do you mind if I say your name or throw a shout out or anything like that? Okay. So we have a patient here complaining of shooting symptoms, knee pain, and after the examination, not all the time is it going to be 1 second. My staff members are impatient to treat, so not all low back shooting pain is caused by low back disc injuries. There could be a dozen things that cause those sciatic symptoms, okay? Because of your Pilates and tight hamstrings, which it can end up pulling like this, can cause the pain. Especially there's a muscle here called the piriformis that does external rotation like this. If you're doing Pilates, you're probably overusing this, which with the tight hamstrings pulling like this, it does end up getting this muscle to push on that nerve that goes straight down, and it recreates those symptoms. Okay. I am compress your spine, but I am going to focus more on the upper leg thigh muscles, work it up, break it, and adjust the joints in the hip, knee to open it up, as well as obviously your spine to just approach it with every angle possible. Okay. Obviously, in order to properly treat it, I'm going to have you gown up because those jeans are not going to allow us to get to the soft tissue that we want. Okay. Oops. It's okay. It's all good. Next time we know. So I'm going to give you a gown. Let's change up. Obviously, Turuskat Bahi, like me, honey. So, okay.
Definitely not doing that. We need that when we're moved.
You sound just like your sister, Jesus Christ. Oh my God. Now that you...
I know, we have the same voice. It's crazy.
All right, buddy, let's go out. Once you're ready, I'm actually going to put a heating pad on the bottom. Okay.
Okay.
I know clinic setting, it's a little cold, so I'm actually going to put this heating pad on the table just to make sure she's warm and comfortable. Okay. Once you're ready, crack the door open. I'm going to have Heidi come and shockwave you. Okay. I'm going to get a towel. 1 second though. Okay, 1 second. So we have the patient laying down, towel, very comfortable. Even though she's given us consent to record the whole thing, I just want to be respectful. We're just going to show a little portion of the end of the distal upper thigh. After that, we're just going to have Heidi here do her thing. We're going to do some shockwave therapy, which is very good for breaking up adhesions like calcium deposits. Very good for joints and inflammation. So we're gonna actually do where the hamstring attaches, which is the ischial tube, which is right in here, okay? And the popliteus. If you guys are having problems with your knee popping and clicking or actually locking and unlocking, this is the muscle in charge of locking and unlocking your knee. So a lot of people do not focus on this muscle. It's very, very important. So after this, Heidi's gonna flip her over. We're gonna do the IT band here, which is like a thick band, and it's so tight it's pulling on the kneecap and causing her knee pain. After that, we're gonna do a full extremity adjustment, spinal decompression. You know we gotta do the Y strap and send her on her way. All right, stay tuned.
I know you told your friend you're not okay, and tell me what's wrong and why you never said you felt that way. Guess you're trying to stay strong and fake a smile until I look away. But I've known you too long, it hurts to watch your blue eyes fade to gray as you fade away.
That's funny.
So this lovely Lucy Hart here sits like this, and then she wonders why she has knee pain.
What do you mean?
This is very bad for your meniscus. Really? Yes, that's how we test for a strained meniscus, actually. It's a valgus varus stretch. So
it turns out I don't have a sciatica, right?
I know you don't. Well, I'm sure there is some increased pressure.
Leave it to Google and,
WebMD,
start somebody that's telling me I have a...
WebMD is the worst doctor in the world.
Well, I had a massage and they just told me that I have this sciatic issue.
Look, you have symptoms that when you read like 2 out of like 20, you think that's what you have.
Yeah.
It's possible, but obviously we're trained to diagnose, differentiate between 20 different things. You have the sciatic symptom, but is it caused from your low back? Is it caused from the tight muscles? Is it a trigger point? There's so many things that we need to rule out, okay? But knowing how busy you are, if you don't know Lucy Hart, she runs a very successful, I don't want to...
It's called a permanent makeup studio. We specialize in eyebrows, microblading. All permanent makeup.
There you go. Check her out, give her support. She does amazing work. She's known in our community, so I don't think I need it, but don't look at me. But I ain't about to. I'm gonna age gracefully. Let's go face down. Actually, I'm gonna remove this. I'm gonna remove the heat pad too. Okay, that way I could decompress. Perfect. Okay, you're comfortable?
Yeah.
Okay. I could expose the back, correct? Yeah. Okay. So if you want to check the leg length, obviously it's not symmetrical. It comes back to symmetry when I do this. So you could tell. Pay attention here, okay? Just how the pelvis is rotating. Okay. So we're gonna correct that too. All right. First, let's do some skin cav. I'm gonna expose this area. Okay.
Yeah.
Okay. Just want to make sure. Have you? There is a little inflammation here actually. So tender. No?
Yeah, right there.
Yeah, L4, tender. L4 is the most commonly injured segment of the disc injury because it's vulnerable due to it being in the apex of the curve of the lordosis, okay? But we're gonna do some skin cav. Jeez. Okay. Do you want to pick that up? Okay. Perfect. All right, we're going to tie your legs. Okay, and then I'm going to slowly distract the table, opening up your spine. Okay, it's going to relieve some pressure and at the same time slowly rehydrate your discs. Okay, you ready? Lucy?
Yeah.
You ready?
For what?
The decompression?
I mean, is it like a pulling?
Yeah, so I'm going to end up putting my hand on your spine, but pretty much you're going to be going through this ranges of motion, okay? Pretty simple. Sounds scarier when I'm explaining it to patients. Okay, so we're going to start at L5. All right, even though L4 you said was most tender. Okay, breathe in, all the way out. So if the main cause was low back injury, this is the main therapy we would be doing. Besides this Cox table, we have a Leander flexion table here at Graston Chiropractic. We have an air flex decompression, and we have a hill decompression, which is like the bad boy. All right, that one is like last phase, severe herniations. It pretty much just decompresses the spine for 15 to 30 minutes. Depends on what setting I put it on. How we doing?
Good.
A little tender.
Yeah, I feel my low back feeling small.
No shooting in the low back, correct? Okay, good. Whatever you do at work, is it sitting?
Mm-hmm.
Yeah, okay. Yup. are you like hunched over, kind of like a makeup artist or dentist?
More like a dentist, like I'm sitting.
And hunched forward, okay. So makeup artists, dentists, and hairstylists all prone to neck pain because they're constantly like that. Okay. All right, we're gonna go one more nice stretch coming up. Breathe in all the way out. Right in here. That's the worst one.
I mean, it's like, I feel it mostly on this side.
Okay. Does it feel like a scab or a bruise?
It feels like a tight bruise.
Okay. Possible just disc bulge. Okay. If it does feel like a bruise or a scab, there's likely disc injury. Okay. But minimal. If it was a herniation, just pushing down, you would definitely notice the pain.
Yeah, no, it's not pain.
Lucy's sister Lily is an amazing artist, and honestly, I didn't realize how identical they sound until just now. She's great.
My older sister and I look super alike.
Alike, really?
And then me and Lily sound
Sound
super
alike. Oh my God. That's crazy. I've had Lily here before, so we'll tag her, show her some support too. She does amazing art pieces. And
she's also the lip blushing artist at the studio.
there you go.
And the skin camouflaging for stars.
And she's actually talking about maybe gifting us a few of her art pieces here, which I think will be cool. Once construction is done, I'm going to have finally like diagrams and posters on the wall. So, all right. Have you ever been adjusted?
Yeah, a while ago. I go to a chiropractor here and there, but it's upper cervical.
Okay.
Because I'm really freaked out again.
Graston.
Adjustments scare me, honestly.
Okay. So he just does the first 2 segments.
He does like this different kind.
Like vibrating?
That's never
Yeah.
these things. That freaks me out. I
Okay.
can't get adjusted like
Sounds
that.
like a Gonstead, okay, which I'm not a Gonstead chiropractor, okay, so get ready because we're about to unleash the Kraken. I'm on. Let's go on your side.
I know with mascara. Are you you're not gonna
Asa. Oh yeah,
like right here?
we opened it up, so just give it a second. Your body's gonna get used to it.
You're not gonna do this thing because I can't do that.
I won't, but definitely let's at least do the axial, which is I'm gonna tie your neck and just pull it.
You could tie my neck and pull it.
Okay, but I'm very good at what I do.
I
If
know you
anyone's
are. I
gonna
wanna be here.
okay, that's fine. We'll
I just that
all
freaks
right.
me out.
If I sense you're not gonna allow it,
Yeah.
I'm not gonna force it. Okay, but most of the stuff is low back.
Yeah.
Let's go on your side, face me, just like that. Okay, we're also gonna get your ankles too. Okay, scared of the neck? It's the best one.
It's so freaky.
Bottom leg straight, bend. All right. So we're gonna adjust the joints you sit on. Okay. Just relax. Perfect. So all he does is the upper 2, huh?
I guess.
Okay. Actually, let's get your hands too. Good.
Oh yeah, my
Elbows. Yeah.
this wrist is like
If you
this wrist has had problems for a while.
don't mean to make you scream, but just relax it. Let me just at least stretch it. How's that? There we go. That just popped right there. Good. Well, you're working with your hands, right? All these muscles are going to be tight. So something simple, just distract your elbow, like your wrist, just like that, okay? And then see,
Oh, you
see,
there's like a
there it
nerve
goes.
that, like,
Well, yeah, you have your median nerve going, your ulnar nerve on this side.
Something up
Here.
Something up here is like, yeah.
Does this cause numbness?
No.
Okay. Your median nerve goes through right there. So let me just distract this and try to pop this. There we go. You felt that?
Yeah.
That just popped. Perfect. Okay. So we got movement. You need to do the stretching. Okay. Breathe in. All the way out. Focus. Good. Breathe in. Out. Good. Good. Beautiful. Your pelvis is rotated. Huh? All right, give yourself a hug. We're gonna do this whole upper back, okay? Perfect. Breathe in. All the way out. Drop back. Drop. Yup. All here. Okay. Breathe in. All the way out. Drop shoulders back. Not jump. Okay. Want me to do your toes? I don't need to take your socks off. Scoot up a little bit.
Up that way?
Up, yeah. And then it is your right, correct?
Yeah.
You okay?
Yeah.
Good. Yep. Did you feel your hip go?
Yeah.
Good. So we got a few here. Good.
Ooh.
Yep. That's gonna definitely help. I'm gonna do another stretch for you just to open up this hamstring, okay? You definitely need it. Relax. Good.
Yeah, I could crack my lip.
That's called a contractor. It's just tight tendons.
When can I do this?
Tight tendons.
My dad can do it too.
Tight tendons. So we need to open it up, okay? Let's go on this side. Face me. And then before the neck, I'm gonna do the hamstring PIR. Bottom leg straight. Good. Relax. Okay. Any problems with this wrist?
No, I don't think so. It's the other one that's, and I'm left-handed. This wrist doesn't have that issue, but this
Elbow?
elbow has an issue
Where?
in the bone area. Like,
The joint?
yeah, in there something's off.
There we go. Was that it?
Yeah.
Problem solved. Yep. Oh, got one here too. There it is.
Ooh!
Yeah, it was pretty bad. Girl.
I haven't been adjusted. You like it's my nervous laugh.
It's okay. It's good to be nervous.
Ooh.
There you go.
Shit.
Yeah.
Was that an adjustment?
Yeah.
My
There's
God.
8 carpal bones, like tiny bones.
Now I wonder why I don't have good circulation in my feet and my hands, and they're always cold.
Let's see if it helps, okay? Breathe in. This really needs to go out. Good. Right in there. Breathe in. Good. Not John. Okay. But you could tell. I know you're tiny, you're in shape, but there's a lot of pressure built up. So come in, because I need to open this spine up, okay?
I mean, yeah.
Meshki vara. I know that these hamstrings have a part to play too, okay? Good. All right. So let's relax this one. So your affected side is this, correct?
Yeah.
I am going to end up putting my hands on your hip bone, okay? Just to stabilize.
Okay.
So relax. I'm going to lift up, okay? Tell me when you feel pain. It's not too
Now.
bad. Not too bad,
Well,
okay?
I'm a flexible
Yeah.
girl. I should be able to go all the way up.
We
and I
will,
can't.
okay? So there's 2 areas I'm going to have you do, okay? Do not do anything until I explain all of it. So you're going to end up taking a deep breath in and you're gonna hold your breath for 10 seconds.
Okay.
While holding your breath, 30% of your strength push towards me with this muscle, and then push up with this. Okay.
So bring that down and
No,
push toward you.
push against my hand, and then this one, and then push this against me. So I need this movement here for the hamstring, and then
Okay, got it.
against my hand. Okay, relax. And then if I see you swaying, I'm gonna stabilize. Okay. All right. You ready? All right. Deep breath in. Hold your breath. Give me 30% of your strength here. Push, push. There we go. 30% up here. 10, 9, 8, 7, 6, 5, 3, 2, 1. Breathe out. Good. Okay, we're gonna do one more. Okay, so what I'm doing right now is I'm actually stretching the hamstrings and the calf. Okay, kind of resetting the brain to recognize where the full range of the joint and muscle fibers are. Oof. All right, ready? Deep breath in. Hold your breath. 30% push and the toes. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Breathe out. Bring it to your head. Bring it to your head. Bring it to your head. There it is. Yep. But we just, yeah, I mean, got a little more for the calves, but I mean, 30 seconds worth of post-isometric relaxation. We increased it by what, 25, 30 degrees. Yeah. Okay. You know what? Let's just do the other side too. Might as well. It's pain. It's not pleasant, but it's very effective.
This doesn't hurt me. It's just like it's unfamiliar, so I don't know what I'm gonna.
Yeah, definitely right side's worse.
Yeah.
Okay, the calf too. We need to work on your calf. All right, tell me when the pain starts. Yeah, it's not bad. Too bad on here.
No pain.
Nothing, huh? No. I mean, you're good. This side's fine. Okay, we're gonna do the Y strap, and then hopefully you let me do your neck. You ready? I have like so many patients waiting.
You have so many patients
I
waiting.
have patients waiting for me.
Oh wait, you're waiting from. Oh, I don't know. Sorry.
It's okay. You ready? Hang stess. Okay. How's that comfy?
Oh yeah, you're so comfy. You're about to crack my neck.
You're gonna thank me. Hang stess. Is that comfortable? All right. Take a deep breath in. All the way out. Good. Good. Just nice, slow, deep breath. Let's do it again. You're doing great. Just keep breathing. I'm only gonna be stretching. Good. Deep breaths in. You're good? It's not choking you?
A little bit.
Okay. Is this better?
No, the other one is fine too.
Okay. Deep breath in.
Hold on, it's just my earring. Okay, go ahead. Let's lift this out. Okay, you could do it now.
Hangis this?
Yeah.
Okay. Hold on.
Yeah.
Good?
Yeah.
Like this? All right. Again, breathe in. Out. Deep breath in. All the way out. And wiggle your toe for me. Good. Good morning. Very tense girl you are.
I know.
Okay. Adi. You okay?
Yeah.
Adi. I have to. Adi. I promise you're not gonna hate
Oh,
me.
you're doing it?
Yeah.
No.
Yeah.
I can't.
Uzmes, I don't need to do it seated. I could do it face
It'll
up.
freak
You
me
are
out.
so tense.
I'm
Merkes.
so tense.
Merkes. You need to open it up. Either face up or seated. Merkes.
Seated is better.
Seated is definitely better.
There?
Yes.
You're gonna do that thing?
It's not as aggressive as you think. I promise. And I'll go quick, okay? And then you could present yourself as I'm adjusting you, if you
No,
like.
you want to just distract me right now.
I will. Don't worry. You okay?
I've heard so many bad stories, people dying after this
God
shit.
forbid, but it's usually not chiropractors, and it's a stigma. Okay.
Okay, tell me what you're gonna do. Show me.
Well, I need you to lean back,
Okay.
relax, say hi to the camera, tell everyone your name and your handle or whatever it's called.
Hi, my name is Lucy Hart. I'm a permanent makeup artist and I specialize in eyebrows and microblading.
And I'm Dr. Rafi Giregian. I specialize in unleashing the Kraken. Okay. Okay. She's so nervous. I got you. Just relax, relax. Good. All right. So see how this is not moving, okay? So I need you to lean back. All right. It's going to be very quick, okay? It shouldn't hurt at all. Just drop your right shoulder. Unleash the Kraken. Good.
Oh, that's not bad.
It's not bad.
No, it's not
I know,
bad.
but you are very, very,
So
very
you're
tense.
basically doing this, you're not doing that.
No,
That's cool. I'm
no.
cool with that. Yeah.
I don't believe in excessive rotation.
Yeah,
That's
the rotation that freaks me out. This
that-
is cool. Thank you. I'm glad I
sure. That is a no-no for me.
Yeah, right?
And
That's
all
so
chiropractors.
weird.
Excessive rotation needs to be removed from all adjustments, okay? We try to focus on just lateral, which is side bending right here, okay? Right there, your upper, okay? Unleash the Kraken, baby. Drop your left shoulder. Good. Jana,
That was
okay?
really good.
Good.
That was high five.
Thank you.
I'm so glad that you did that.
I am too. I know you needed
So
it.
much. Oh yeah.
We could have done designer series. Louis Vuitton.
I just bought them yesterday.
A lot of Mashas.
Hey guys, Dr. Rafi's interrupting me during my interview.
Bye.
Okay, so I just had my treatment with Dr. Rafi. It was really amazing. The staff is really great. It's so busy in here, which is always a good thing. I feel a lot of relief, and I'm really glad I let him adjust my neck the way that he did, even though it's freaked me out for a long time. But hopefully, you know, after another treatment, I'm able to go back into Pilates and do my workouts because, you know, it's part of my life and it's miserable right now that I can't do it. So yeah, I'll be getting treatments very often so that I can continue doing the things that I need to do. So thank you, Rafi.
Oh, happy anniversary.
Thank you. Merry
December 4. Merry Christmas. All right, this is Galil. Seth Galil. Okay, so let's go face up. Yeah, I'm going to get right into it. Yeah? We're doing toes too? Oh, yeah, we haven't posted toes in a while. One time I adjusted her husband's toes, and then the same video did her neck, and like it was just funny. People thought it was...
Yeah.
All right, let's go on your back. We're just gonna get right into it. Some patients come in, they want to get in and out during their lunch break. Just let us know when making the appointment. We could try to accommodate as much as possible, and give us a thumbs up and like in the comments. Oh, there's your wrist. Jeez. Get in here, or actually, microphone. We'll get it. It's just smaller joints, so there it is. You know, the pops are just pressure leaving the joints. So these wrist joints, they're smaller joints, so there's just so much pressure it could be built up. Okay. Breathe in, out, drop it, drop. Okay. You ready? Oh, jeez. This is gonna be good. Breathe in, look straight, drop this shoulder, drop it. Right. Nice. There you go. Look what came out of your armpit. Can I?
Yeah.
Sorry. Bam. It's okay, you don't need to do it, but just need to get a good grip. Yeah, there we go. Just feel like this needs to go. Okay. Let it go, let it go. Good. So we got the tarsals, which is what I do with this move. And then we get the ankle and the hip with that one. There we go. All five, huh? Nice. It's just this might be distorting the... Let go, let go. Hip, 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 hip. Good. Let's go on your side, face me. Look, Ma, no hands. No, no. What movie is that from? All right. And good. Other side. Let it go. Nice. Good. Yep. There it is. And low back. Hold on. Right in here. Out. Good. Let it go. Let it go. Let it go. Oh. All right. Depending on the patient, sometimes I'll have them put their legs down like that to give me some more extra stability or support, which can help in the adjustment. Are you comfortable? Mm-hmm. Just let it go. Relax. There we go. Good. All right. Breathe in, out. Breathe in, out. Keep breathing. Out. Beautiful. Jana. Welcome back. You're welcome. Alright, let's see. Very happy anniversary. Has it been a year or 2 years?
2 years.
Yeah, my son wasn't born. And then met her as a first date, brought her to me. I was able to tell if she's a keeper or not by the way her neck was aligned. Gave him my blessing, and the rest is history. They're married now, 2 years now, and they're going strong. I swear to God, well, this my Armenian patients will know. If I'm ever a kavod again, I'm gonna hashtag Chiropractor everywhere. People out there in need of a kavod, I could be your Chiropractor all day. All right. Drop right shoulder. All right. Lean back. Lean back. Let go. Dude, you could tell it's been a while. Mm-hmm. There. Seriously? There's one. Really gotta get that one. Let it go. Drop. Alright. Oh boy. Ooh. Okay. I love that you're smiling. Welcome again to the clinic. Obviously, it's unfortunate that when I see you, it's usually because you have pain. But I'm gonna sit down as much as I can to make it eye level. So let's just talk about what you're experiencing.
Okay, so basically, I have really bad pain in my neck and my shoulders. There's like hard points that like trigger points.
Okay, trigger points or spasms.
And I get a lot of headaches that shoot to my eyes because of it.
So it goes in this pattern, nothing straight across.
Yeah.
Okay. Little background, I know you do a lot of computer work and you're on the phone all the time, so it is more common. I am seeing rolled in shoulders, so everything here is getting tight and pulling like this. Right. So the muscles in this region tend to give you headaches, especially if it's going all the way to the eye region. All right. So any numbness, tingling down the arms.
If I'm in a position for a period of time, then sometimes I get tingling, but not as often.
Is this pain every day?
Headaches, I want to say at least 4 days out of the week.
Okay. So we're gonna do some trigger point therapy with one of the doctors, kind of relieve the headaches. Obviously, we're going to give you an adjustment with the Y strap, but I do want you to actually get treated on this hill decompression table. It's going to just open up the spine, okay, especially in the cervical, the neck region. It's going to allow it to move properly, which can also help get you pain-free, okay? So before this, actually, I'm going to have them work on the trigger points, okay? I do have Dr. Hart here. She does acupuncture, so even if not today, next visit, next Wednesday, if you want to come in, she could actually put needles in those trigger points, and it's called dry needling, and it's pretty effective. So it's actually gonna be a needle going into that adhesion, and that trigger point actually grabs it and it dissolves. Okay, so it's very, very effective. All right, let me get. All right, everyone's busy treating patients, so I'm gonna go ahead and actually do some manual trigger point therapy. All right, so what I'm trying to do is palpate and locate the actual trigger points. Okay, which, oh, there we go. All right, just lean back for me. So when I push down, I'm trying to recreate the pattern of the headache. All right. I'm pretty sure this is tender, but is it pain where I'm pushing, or are you feeling it somewhere else?
Pain when you're pushing.
Okay. So for this, we're not looking for that. We're looking for referred pain. So how's that one?
That's kind of going to the eye.
To the eye. Okay. What we do here is we just apply pressure and don't let go, because it's trying to push back, and you push it long enough where it gets tired and kind of melts away. All right, just relax the shoulder, relax it, let it go down. Okay, has it decreased at all?
Yep.
Okay. Yep, there it is. Okay, so now that was the trap. So next one that's common for that area for the headache is the levator scap. More commonly the insertion. There it is. Alright. So, okay. Where were you feeling that one?
Just going to up a little.
Just to there? Okay. Breathe. How's that one?
I feel like that's the one.
That's the one?
Yeah.
Let me get a good contact for this now, John. Just shake the chest again. This one, right? Okay, there it is. Breathe. Yeah, you do need a lot of forearm strength and stamina. But doing this for over a decade now, that's it right there. Okay. Yep. It's not pleasant, but for me, it's gonna be tender and uncomfortable and painful. Might as well just go a little aggressive and get it resolved in like 1 or 2 visits. Saves the patient time, money. Ooh, yeah. Okay, that right there. Breathe. Okay, and then slowly this pain will decrease. Then we will start pushing harder on that spot until the pain is no longer there. Yep. Do you get it only on the left side or the right side?
I get it all on my left. If you remember, I had broken my humerus.
Okay.
So this shoulder always has more.
Has issues,
Yeah.
okay. And it's this spot, okay. And sometimes it is a good idea to go in with the elbow, okay, just to save my joints. Yeah.
Ow.
Yeah. Okay. Breathe, good. Is that shooting to the eye?
Yeah, it's going to the.
Can you just show the pattern that it's going into?
So it's going up to the neck and then going around to like this point.
Again. Yeah. There it is. So when I tell you that the body is a map and every area has like a segment, a level, a muscle, organs, this is one of the diagnoses that actually draws it up for us. Okay, how's that? You okay?
Yeah.
Is it to the eye still, or?
Now it's going a little bit like halfway here probably, and then that one.
As it gets better, now we're reversing it. It's going from the furthest point back to the origin.
Oh, this one.
Yeah, that's it right there.
Oh, that one is.
Yep.
Wow.
Yo. Breathe. Out. I'm gonna give her a break as well as myself. Probably start on the other side and then come back to it. All right, perfect. We're gonna hook you up. Ready? Love when the wrist goes with that. This direction.
Oh.
Yep. Okay. All right.
Yeah, I'm fine.
So breathe in. Jeez, shoulder just popped. Breathe in. Out. Drop shoulders back.
Wow.
Yep. Lot going on. All these ribs.
Oh my god.
You ready?
Yep.
Yeah. All right. So I like the hug move because I get to contact and adjust the ribs at the same time. Plus this pushes out the shoulder blade, exposing all these ribs here. So what I'm gonna do is contact the ribs with my thenar, and it's gonna go out. On your side, breathe in. Other side. When it pops before I thrust, that's a sign of a good setup. Good. Breathe in. Out. One more. Scoot down. Is this? Breathe in. Out. Okay, keep breathing. Out. Deep breaths in. Out. Good. Wiggle your toe. Nice.
Oh my god.
All the way down.
I felt that all the way to like.
Yeah. To the tailbone. Yeah.
Yeah.
Okay.
That was amazing.
Good. Smile. Got that dimple. Good job.
Wow.
Good. See, that's why I wanted to open everything up so we could just do that. This is the first time it went all the way down.
All the way down, first time.
That's why I like using this. I get more control.
Amazing.
Dude, look how straight you're. Yes, there we go. That's right. Now go get to your meeting on time. You don't want to be our meeting standard time. Merry Christmas, Kim.
Merry Christmas.
Happy birthday.
I felt it from the top all the way back to my tailbone. I have never felt that before. It's just one of a kind adjustment, and I highly recommend it. Thank you, Dr. Rafi.
Something's different. You lost weight or 10?
No, I probably just don't have any eye makeup on.
Okay.
But I'm like excited to see you because I need to.
I'm curious. When you do a Face ID on Apple,
Yeah.
without makeup,
still,
does it recognize you?
Yeah,
still?
it does a little bit. Yeah, and then when I wear my glasses, I'm like, it doesn't recognize me. But yeah.
All right. Well, thank you for being here, letting us record. So, one of the most energized personalities, by the way. She's amazing. If you want, you could even give a shout out to what you do and stuff, if that's what you want. Okay. So, what brings you in today?
Oh my gosh, just need to be adjusted by the end of the year.
Okay.
Tension, obviously, because I travel a lot and I lift bags for work. Middle of the back is stressed, and obviously the neck is my main priority.
Considering, I think this is like your 4th visit.
Yes.
Significant improvement here. We can do it before and after too. I'm sure you don't mind, right?
Yeah, not at all.
She has a hump starting to develop due to always being on the computer and hunched forward. Nowadays, it's called text neck, but your head weighs around 11, 12 pounds. But then if you tilt it at 15 degrees, it then goes up to 20 pounds. If you end up texting like this, it actually puts 60 pounds of pressure on your neck. So that's what's going on. There's inflammation building up because the CT junction, see, when I extend, I need to feel it all the way down to T4. It actually gets stuck right here. So when we do the axial adjustment, that's going to open all of this up, and then you'll visibly see the movement down to here.
Do pillows matter when you're sleeping? Because obviously when you're sleeping,
yes,
you know,
try not so
not too flat.
I personally love the pillow, which I recommended. They discontinued it, so I haven't found something that I believe in to actually promote to patients. But I like the 2 humps.
Got it.
So there's a big hump and a smaller one, and whatever position you're in, you have to make sure your neck is like in a straight neutral position. If you're tilted down or up like this,
I know.
no, you're gonna
yeah,
tear
then you're
things
tweaking your neck. And
Exactly.
I tend to see that in my
It's
sleeping
better to
patterns.
be without a pillow in that case, honestly.
Okay.
It all depends how you sleep too,
Got
like
it.
stomach or whatnot. All right. Someone said you got diagnosed with
Carpal tunnel now. Yeah.
Okay.
So I'm seeing a surgeon to possibly
MRIs, ultrasound stuff was done.
No, not
to
the ultra. I
diagnose.
just had the EMT or EM,
Okay.
whatever
and
that.
CV.
Yeah.
Okay. Not
So-
a problem. We're okay to adjust those as well, correct?
Yeah, definitely.
Okay. Oh, you've had it before.
Yeah, roller skating accident.
Okay, not carpal tunnel surgery. I mean, when we
TikToking.
studied, carpal tunnel is one of the most overly diagnosed. Okay,
Yeah.
but if it's done with proper studies, then yeah, because there's so many different symptoms that can cause numbness, tingling, or carpal tunnel type symptoms. That's why we say it's overly diagnosed. But if you went through the proper testing, then I have no doubt that's what it is.
Yeah.
Okay.
Okay.
So let's get you started. Let's do some stems, muscle, and then we'll get some muscle work done, and then we'll get you adjusted, and then hopefully we could show the whole world that beautiful bright smile of yours. Okay. Gina.
So excited.
All right. Perfect. It's nice. It's a lower, huh? This room. Okay. Let's get them started.
Okay.
Yeah. It's mostly neck.
Yeah, like mid. It's all like I carry it all in here.
Nothing here. Then we could even do it seated if you're more comfortable.
Yeah, whatever
Okay.
works this way.
Sure.
Back towards me.
All right. So we'll do. Let's go muscle spasm here and down here.
I feel that.
Muscles here could also cause headaches, definitely right in there. We also have acupuncture coming in on Wednesdays if that's something you're interested
Yes,
in.
for sure,
And
especially
then
for the carpal tunnel.
IFC. Oh, she's great, by the way.
Cheers. I
Let me know.
Okay.
She comes in on Wednesdays, okay?
Okay. Thank you, doctor.
Of course.
Take me back to a place where I felt at home. Take me back to a day when we weren't alone. Take me back to an age when the world felt small. Way back before we blew it all. Take me back to a place where I felt at home. Take me back to a day when we weren't alone. Take me back to an age when the world felt small. Way back before we blew it all. Too many things going on, I can't keep track of them all. From people dropping a bomb to people putting up walls. I feel like life is on hold, perception stuck in a vault. I know that time can heal all, but how much time till we fall? It's awfully chilly outside, when there's no shelter to hide. When everything is a lie, you'll find that out in some time. But when the things on your mind are all considered a crime, communication aside, we'll all just fight till we die. Is this an argument, or just the start of it? Either way, I don't wanna be a part of it. Can I just get some space? I don't.
Come on now.
Look at those.
Right there, bam.
Bam.
It's like,
And look at these. Look at these. Look at these.
these are the hyperspaces. Back when I got them, you could only get these in Asia. But last year, they released them on Yeezy Day. And,
Oh my God, you're Yeezys.
yeah, well, comfortable.
Ready
so
for the holidays.
Yes.
Oh, that's what she good at Instagram video.
What is?
That was.
There we go. Well, with Gina,
Help me.
Gina, I'm just going to leave it at that.
G money. It's
Okay. Oh, we're even going to do her toes.
don't.
All right. I know we said we had a bicycle accident. I do see scarring, possibly a surgery.
Metal
Okay.
plate and screws.
Where? Wrist?
Yep, wrist.
Okay, so
Yeah.
We're not gonna, we're gonna adjust? Okay. So adjustment is technically just a mobilization. So even if I just distract and mobilize, you know, that's all we need to do. Mobilizing the joint so it moves to its optimal potential and allows the muscles, ligaments surrounding it to also do its job properly without pain. Okay.
Yeah.
Jeez.
I know. It's all in there. Oh, see, it's all coming.
It's all connected. So the body, we call it a closed chain. So from head to toe, it's closed. So anything that's not moving properly here can indirectly affect the way you walk, let's just say. Okay. So yes, especially this extremity, it's all connected. Okay. Next time, let me know if your carpal tunnel symptoms improved with this.
Yeah.
Okay.
For sure.
Good. So these wrist joints, they're tiny, so don't expect the loudest pops, okay? But you did feel them shift.
Yeah.
I do ask all my female patients, I am gonna push down like this. Does that hurt your breast tissue? No? All right. One more. Oh, popped already. Out. Good. Drop shoulders back. Good. And here is what I want. We're gonna do something a little different. I'm gonna have you bend your knees. Okay. There you go. Relax. Okay. When I tell you, I want you to do that exact same thing. For you chiros out there, there's a junction here. So when she lifts her hips up, it flattens this CT junction, gives me a better contact, and allows for a better adjustment. Out. Shoulders back. Lift your butt up. Good.
Oh gosh, we needed that.
All of it. Okay, let's get her toes. You all right?
That was all the way here.
You good?
That's crazy, yes. Oh,
jeez.
I know. I need...
Good. Sometimes you do hear the hip pop, but I mean, I'm sure you felt it.
I felt it. Oh, yeah.
All right, so they taught us in school, it's not that your patient's feet are dirty or anything, but it's a good bedside manner and just common courtesy. Since I touched her feet, I always make sure to sanitize or go wash my hands before continuing touching other body parts, especially at the end is where I do the neck. So it's just a common courtesy.
And I appreciate that.
Of course.
Thank you.
Let's go on this side.
This way?
Yes, ma'am.
Sideways?
When I do the toes and head and stuff, it's like from my head down to my toes.
What song is that one?
I don't know, but and then we got your neck, your back. Dr. Rafi, adjust all that. No, don't. Just let me finish, okay? Kanye. All right. We're going to adjust the low back. Ow. Good, right there. Good. Other side, and we'll finish up with the hands too. So once I open up the neck and distract it, we're gonna put you on the neck decompression, okay? Just to open it all up, yep. That's all three. Oh no, we did the right hand. This is we haven't done this side yet.
I thought we did.
It's okay.
That's crazy.
Just relax it. Good. Beautiful. All of them. Okay. Breathe in. All the way out. Good. There it is. Perfect. All right. Let's scoot down for me, please. I wish and this is my thing. When the patient comes in like crooked, in pain, right? I don't like to say, oh, hold on, let me record this, whatnot, especially if I was able to do it before and after first visit, like every visit showing the change.
Yeah,
okay.
so much better, yeah.
Well, you're even.
Yeah.
Okay.
I'm aware of it.
Yes. Let's scoot down. There we go. Perfect. Okay. Obviously, she's light, so having her legs down like that is gonna allow me some more resistance and to prevent her sliding up. Okay. Comfortable?
Mm-hmm.
Good. How's that feel? Mm-hmm. Good. Okay. Deep breaths in. All the way out. Just relax the neck. There we go. Keep breathing. Out. Beautiful. Deep breath in. Out.
Oh, God. Holy.
That's right.
Sorry.
It's okay.
Oh, my God.
Let it out. Give it a second. There you go.
Yeah.
Yeah, you get so tired and relaxed right after this one.
Oh, my God. That's crazy.
Yeah. We got them.
Yeah. It's like a can of soda that just...
Come on, girl. You're classier than that. Bottle of champagne.
Bottle of champagne. That's it. Bottle of Veuve.
Sparkling wine.
Sparkling wine.
Prosecco? I call it
Prosecco, yeah.
prosciutto. I don't know. But Prosecco, yeah. There we go.
Okay.
All right, we're going to do a seated adjustment in another room, and then
Can't wait.
we're going to do the decompression at the end.
Okay.
Gina?
Yes.
This is not a nuclear launching
Emergency.
device. This is just,
This is I want to get off the ride.
Got it.
Okay.
So I have her set at 5 pounds right now, okay?
Okay.
Force.
So
Everything
we could
is
go-
set,
we
program
could-
one.
We could go 8.
Okay, it's gonna pull you from here, okay?
All right.
Ready? Go 8.
Mhm.
How's the intensity?
It's good.
Well, right now it's not even halfway. So I'm gonna dim the lights so you can relax.
Thank you, doctor.
Yes. Is that too romantic or?
No, it feels good.
That's good.
Yeah.
Any pain?
No pain.
Okay.
No pain, no gain.
So now it's gonna. Let me just increase. So it's going to 9 pounds. So right now this is at 9.
That's at 9. Yeah, I feel the stretch.
Do you feel it?
I do.
Then I think this is good. Trust me, for
Yeah.
10 minutes, it's gonna take you to 9 pounds, take you down to 4. So it's creating that pumping action, and it creates like a vacuum effect. So it slowly opens it up, allows the rehydration of that disc, the leaked out fluid. Okay. So this is one of the best in the game, and it may take some time, but this is what I'm personally using for treating my neck as well. So you good, Gina?
Yes,
All right,
thank
I'm gonna
you.
put a timer, come back in 3 minutes, okay?
Okay, thank you.
Mhm.
So I have to say that this machine was phenomenal. It stretched my neck without feeling aggressive. It just felt where it needed to be felt at. What I love about Dr. G is that I've been to so many chiropractors, and they just, do here, do there, adjust a little at a time. But I have to say that Dr. G knows exactly where you need to be adjusted and how to do it the proper way. And I walk out of this office feeling amazing and feeling rejuvenated, and something has been done, and I can walk and I can feel loose and good again. Thanks, Dr. G. Appreciate you.
All right, so we're here. This is the second visit after receiving the first treatment. I just want to get an idea of what you're experiencing, what's improved, what hasn't changed, so we could start approaching it differently or continue the same progress. How'd you feel? Were you sore or anything like that?
I was sore. Day 2 was sore.
Okay.
Yeah, but definitely pain was has been decreased.
Okay.
On this side. So
To the shoulder
yeah.
blade pain.
Yeah.
Okay. It's coming less, and is the pain level still the same, or is that improving as well?
Yeah, it decreased.
Okay.
Yeah.
And how about your headaches?
I stopped smoking.
Okay.
It's good.
Nicotine?
Yeah.
You smoke.
Nicotine
Okay,
free.
tobacco.
Exactly 1
Okay.
week. Since
Okay,
last
so
time.
that could also
Yeah.
avoid it. But anytime you guys are trying to quit anything, it comes in threes. The first 3 days are the hardest, okay, and then you get another one around the three week mark where your body's trying to, let's say with nicotine, it's a very addictive because you have actual nicotine receptors in the brain. So once you start introducing nicotine from the outside, they no longer they actually produce more receptors to be able to take on all the extra nicotine. So around the 3 week mark is where the body is understanding that no extra outside nicotine is coming, so now they're starting to adjust to that. And then the 3 month mark, once you reach 3 months, you're completely not dependent or addicted to that substance. If anything, it's just more of a mental and habit kind of addiction.
To me, it's all mental.
It is.
I quit so many times.
Mind over matter. I get it. Just don't go to Vegas. Don't go to Vegas because you know Vegas.
We just booked 5 minutes ago.
Oh, man.
Trip
So,
to Vegas. But
it's okay. You'll quit again after the trip. But I mean, we're joking.
No,
but
this is
yeah,
good. This is good. I definitely don't feel that pain as it was as no movement.
Okay.
So right now, it's only when I pulled a little bit, it start,
You feel.
But other than that,
okay.
it's been better.
Good.
Definitely
So
better.
continue.
Magic touch. Yeah.
Continue the chin tucks. Okay, so we're gonna go ahead and set you up on the cervical decompression, and then we'll finish it up with an adjustment. Okay, I'm gonna have one of the G team members come set you up. Okay, buddy. All right. Have fun in Vegas. TFTI. You don't want to take your chiropractor with you? I'm pretty fun on the blackjack and the craps. Bam. You weren't like extremely sore or anything, correct?
No.
Like
It just start pulling on the other side, like you said. It would, on the other side.
All right.
Other than that.
It is common for us to increase the stretching, the pressure by 1 pound.
Okay.
Which I think it's a good idea to go ahead and advance you. Okay. Not saying we're gonna always advance you by a pound, but we're gonna treat you until we find the perfect
Last
level.
time you did 14 pounds.
We did 14, okay, which is conservative considering your height and weight. So 15,
Right.
again, I think we'll have more benefit than 14, okay? But pay attention if the soreness would not last longer, then we could always go back to 14, okay? So let's go, Dr. Andy is gonna help set you up. Cervical, Dr. Andy. So here you go, buddy.
Thank you.
Dr. Andy, yeah, you get both of us.
You get 2 doctors.
I know we're a high volume clinic, so we got 4 licensed chiropractors, and then we also have a chiropractor who has one more board to pass, and will be licensed as well. So
Scoot a little down for me. Is it nice and cozy?
Yeah.
Yeah. Scoot a tiny bit more up. That way. There you go. So on the starter, you're gonna let me know if there's any pain. Okay. Do you feel the stretch?
Yeah.
Any pain?
Not at all.
Perfect. So it's gonna do this for about 10 minutes, okay? Again, if it hurts, please press stop button. Okay?
let's go. It's hard running a high volume clinic. All right. People ask how much I work out. I don't work out. I just do chiropractic.
So
I'm glad you find that. Yeah, you need to. Sure, yeah.
I don't remember.
Wait, was this on when I went to wash my hands?
Yeah. I don't know. What do you do out there?
I just wash my hands.
Okay.
Thankfully.
With
Okay.
everything.
Bro, can you not lay like that? Like you're asking me to paint you like one of your French girls?
So that's
Oh my god, bro, that's hilarious. Alright, buddy. Thank you for being patient. I forgot how soft your skin was. When you guys going to Vegas?
Next week.
Oh yeah. When are you available next week?
We're closed Monday, Tuesday for Christmas, but Wednesday.
We're going Tuesday, Wednesday. We'll come back on Thursday, right?
Yeah.
We'll be open Wednesday, Thursday,
Friday, right?
Yeah. Jeez.
I always do that every day.
No,
Not that way. That way.
That's not good because when you turn and do it, you're taking muscles that are tight and pulling the joint outwards.
Oh yeah.
When I'm doing it, I'm actually pushing it inward. So when you're overstretching muscles and ligaments, and eventually, if that ligament is connecting bone to bone or the tendon bone to muscle, it can loosen it, and that's where the instability and the shaking can take place. Okay, so just let me do it. Face up, buddy. Yeah, face up. You alright? guys too. Hold on.
Huh?
Let's get these two. Scoot up a little bit. Thank you. Bro, you gotta wear cooler socks than that.
Cool.
Drop it, let it go. Alright, let's go on this side. Face me.
You're back.
You're really relaxed, don't you? Can you scoot down just a little bit? Perfect. There you go. Alright, deep breaths in. Out. Good. Just keep breathing, brother. Out. Deep breath in. Out. Dimitri. Is that what
You know that those first 5 seconds, it's like you don't want to talk to anybody.
No, it's all good.
You know?
I just needed a response just to make sure you're okay, but no, I know you're good. You know, but the viewers don't, so it's like suspense. But I want to assure you that that's completely normal. Like the whole time, the body's trying to figure out what just happened. All right?
Yeah.
It's still elevated, man. I'm gonna break that up real quick. Let me just see if the other room is available. All right, let me just break this up for a sec. Sorry, but I'm gonna go right into it. Oh my God. Do me a favor, grab the bottom of that and move to the other side. You could actually do this at home. So you could grab the bottom of a chair, okay? Now, move your body to the opposite side, okay? That pushes the shoulder down. Now we're isolating on these muscles in this region. Now with your other hand, I know this kind of recreates your pain, but this is a good stretch. You could, not to the point of pain, stretch it till you feel like a good stretch. If you're at a point where it's hurting, you've gone too much, okay? And just hold it there. Now breathe. Exhale. When you breathe in, muscle tightens. Exhale, it relaxes. And just 30 seconds each side. Now, if you go opposite side, that isolates or focuses on one muscle group. You can grab the back of the head and push a little forward. That will help stretch a different type of muscle group. Okay? And then, what I like to do for the SCM, which is that muscle that I believe they operated on. Okay? You kind of depreciate or push down your chest and you could stretch backwards and you'll feel this muscle, which that is controlling all of your like rotating of the head, especially if you're a shoulder sleeper like this, that muscle is gonna be overworked. So just backwards, because the insertion and origin, they're kind of like in the front position of the body. So if you push the neck back, it is stretching this muscle, okay? And I like to do the chest because if you don't, it's gonna follow with you. So this resists it and is allowing you to isolate that muscle group, okay? So this one though, for sure, this stretch is very good for you, okay? But if it starts increasing your, oh my God, yes.
Reflex open or no?
Yeah. Just give me 2 minutes. Yeah? Okay. You alright? Alright. Tell me. He's keeping you happy? He's behaving? Yeah, tell me right now. Yeah, buddy. We felt something break in there, so that's good.
So what do you feel? What do you feel like when you push it?
I feel, well, for me it's adhesions, it's scar tissue. So you feel that little crunch?
Yeah.
That's not normal. A healthy muscle shouldn't have that. Okay, so right, ooh, jeez. Are you feeling it where I'm pushing or shooting elsewhere? Is it the pain here or somewhere else?
No pain? Yeah.
Right there? Yeah. Okay. You could tell there's like some inflammation here. So these are scalenes, very, very tender. Oh, yeah. I feel like I could have been like one day interrogator. I would have been really good at that stuff. So, U.S. Army, if you need me, ready to serve. You alright? You ready? Alright, I'm just gonna move this a little bit to this side so I can really get this lower cervical. Lean back, relax. Alright, relax. Gotta make sure you relax. A lot of muscle mass here. Drop your left shoulder, buddy. Drop it to the floor. Lift your leg up. Oh. Ooh.
That's a different one from.
I'm on this side, bro. You alright? Yeah. Last time, I don't think we even got that side because the muscles were so tight. So for it to even mobilize, that's actually a very big improvement. So I stuck my elbow in here to kind of shock the muscle so it doesn't fight back and resist. So we got a big cavitation, which is the fancy word for like a pop sound, okay, or audible. All right, that was great. You're gonna notice a huge difference, okay, from the first visit. Relax. Yeah, we even had a first rib go on that. Just lean in, just drop right shoulder.
Yeah, it's my favorite one.
Where are you looking there? I'm on this side.
Sorry, brother.
Happy holidays to you.
Thank you, man. Thank you.
Have fun. Play some craps.
Thank you so much.
Craps. I don't know if you want to get these in there. Anyway, I know that I didn't really match too much with the scrub color, but you know, I had to bust out these Christmas ones. Keep breathing. All the way out. Good. How's the pressure?
Good.
Nice. Good. Keep breathing.
Oh my God.
Yep. All the way down.
Oh my God.
Yeah.
I felt that all the way down.
There you go.
Holy.
You can say.
I almost cussed.
It's okay.
Holy shit.
There you go. Great. Breathe in. Out. Breathe in. Out. In. Out.
I knew what to expect this time.
You did. Out. Breathe in. Out. One more. Up.
My back.
All the way down.
Oh my God. Oh my God.
You okay?
My brain cracked.
Your brain?
Yeah.
Well, happy Monday. Take a deep breath in and out. Sorry. Yeah. I love how I induce patients cracking up before I unleash the cracking. Ready?
Mm-hmm.
Breathe in. Out. Oh, ready. Breathe in. Out. Beautiful. Let it sink in.
Oh my God.
Stop laughing because I'm going to start laughing. I wish I experienced that.
Holy shit.
It's okay. Deep breath in. Out. Breathe in. Out.
Oh. Oh.
Yeah, keep breathing. Good idea.
Ooh.
There you go.
That was a good one.
Good. Yeah, it's always good. There it is already. Good. Let's do this one more time. Out. Just gonna move it around, loosen it up. There it is. Good. Okay, one more. Awesome. Yep. Okay, as you inhale, I'm gonna let it go. As you exhale, I'm gonna give you a nice stretch, okay? I'm gonna keep asking you how the pressure and how it feels. Don't nod or shake your head. Just say yes, no, or thumbs up and down.
It's a lot of pressure right now.
It's too much?
Yeah. I feel it like in lower right here.
Well, you need it. Now I'm gonna open up the spine like from the top down, okay? But I will only try to adjust what your body allows me, okay?
Oh.
Too much?
I just feel like it's tingling right here.
Yeah, okay, so we're gonna let it go a little bit. You know what? After this, let's put them on the air flux, okay?
Okay.
Yeah. Deep breaths in. Yeah, got a lot of muscle tightness here.
Oh, it cracked.
Good, good. Just gotta be relaxed, okay? If the muscles are tight, we don't want to force anything to go. We want it to go on its own.
Oh.
Jack, we have doctor of acupuncture in this clinic, a massage therapist, and then starting January, we're bringing in a pain management doctor.
Oh.
So they're gonna do trigger point injections, PRP for hair loss, facials, or any joint pain, okay? Testosterone replacement, you name it. Deep breaths in, out. Good.
Oh, oh,
yeah,
oh.
Keep breathing, you're doing great. Out. Nice. Deep breath in, all the way out.
Oh, shit.
Yeah, baby. I felt that go down.
Oh my God. Wow.
Give it a second, brother. You're gonna get like it's a pretty big adjustment. It takes a few seconds. Let the fluid in the spine.
Wow.
Go. Yeah. If you're feeling nice and relaxed, that's the endorphins.
Dude. Wow.
Yeah, buddy.
That was intense.
You're gonna go home and knock out.
I can't have to work.
Oh, great.
Bro, I felt it from like the top of my back to my head to like to my lower back, everything.
And you were relaxed, so I was able to get it. Out. I'm just gonna hold it there, okay? Just relax. One more. Out. Nice. One more. Nice deep breath. And out.
Oh my fucking God, is that what it feels like?
Yes, it is.
Wow, oh my God, get that, come get that done.
You see how excited she is? Come get it. Yes.
Oh, shit. Oh my God.
Yes, take it in, take it in. And out. Good. And just keep breathing.
Whew.
There you go.
Wow.
Good. Okay, switch on. Out. Breathe in. Out. Good. Just take it focus. shit. Woo! I think I'm taller.
You are. You will be.
All right. Beautiful. Coming up. Right there. Oh, hi. Yeah. I don't know what that means. Georgian. Amazing
Do we
woman.
turn the volume off on this?
What?
Oh, we talk. Do they hear us talking?
No, you're fine.
I mean, they do, but she'll edit it,
Well,
right?
I edited
Yeah,
it.
perfect.
Yeah, so I'm gonna edit
Alright,
this
it's coffee
entire part,
muffin
right?
meta honey.
Okay, ready?
Sleep.
Serious.
Alright, we're right there. Jeez.
Much needed, right?
Yeah,
I
amazing.
swear, I know I needed it.
Yeah, you did.
Wow. Oh my
Oh,
god,
yes.
it feels so much lighter. I feel like my head's about to fall off.
Okay, yeah, you don't. So you're gonna be sore for the next few days. Yep. All right.
Ow.
Yep. You're gonna call me and thank me Monday.
Okay.
As I was palpating, trying to locate trigger points, they weren't really the causes of her headaches. So doing some range of motion, we noticed that it's more due to muscle tightness. So I'm actually going to change today's treatment from trigger point therapy. We're actually going to go ahead and do some Graston and IASTM tools, which we're going to use to scrape all the scar tissue, open up the muscle fibers. We're going to increase the histamine response. When something swells up, come on in, Jason, bring the Graston tool, sorry. When something swells up and we increase the histamine response, we actually start the repair process. So these are the actual Graston tools, which is what we use here, which is honestly the top of the line stuff. So we expect to get redness, petechia, okay? Kind of like one of the videos we had showing me getting this treatment, okay? Highly effective. We're gonna start with this one. This is looks the scariest, but it's more surface area, okay? So we're gonna go ahead. The tool is disinfected and it's a little cold, all right? We're gonna use this ointment and we could tag them. You might get some on your hair, okay? If you come here, you could totally see like the swelling here. So that is definitely an inflamed or pissed off muscle over there. Perfect, okay? Jeez. And it's always the tiny ones with the most injured tissues. You're good, Jason. Thank you, buddy. Just leave it right there.
Botox there too, and it didn't.
Really? Yeah, and I have a lot of patients before or after getting Botox for headaches. Come get this done. Let's just put your arm down like that, okay? So we're just gonna go like this. All right, you can even see that that's actually your levator scap, okay? So see, it's already turning red. That's what we want, okay? Hi, yeah, you feel that, huh? All right, let me know if you want a little more ointment on it, but I don't want to get too much. And this is what we want. If you want to get back here, you can totally see it working, all right? Again, I do not do this on the first visit. And see how it's starting to swell now. So that's exactly what we want. I am gonna go more, but we want it to kind of get a color of a light bruise, okay? So what happens when your ankle swells, everyone? Your ankle swells to prevent more mobility of the ankle joint, to prevent increased injury. So when it swells, it is your body saying it needs to immobilize so it could heal itself. So this is kind of the same concept here. So we are making it swell so we get the histamine and the repair process started. So this is actually exactly what we want. You could scream, it's okay. I know it's not the most pleasant. Some patients have said,
uncomfy.
Yeah, some who have tattoos say it's worse than getting a tattoo, but no, this Graston tool is a lot better, more patient friendly for sure. Trust me.
And that's what we're starting with?
I'm using Graston. Graston tools, yes. Good. go. Okay. So now I'm going to use. Okay, and let's flex forward. Okay. This will isolate the levator right in there. Okay. Swelling right in there. So I know we're going to get it in your hair.
Okay.
But this right here is completely spasmed out. Yep. Okay. And I tell my female patients, especially if they have like birthday parties or weddings where they're going to wear dresses that are going to have the back or the neck area exposed, maybe to wait, because there is going to be certain redness possibly. So this is really jacked up right here, abs. Okay.
Perfect.
Yeah.
Remember I showed you my MRI?
Yeah.
It was all up in like
Uppers.
Yeah,
right?
yeah.
Jeez, this thing is, and the redder it gets, the faster it gets red, the more injured that area is. So this is worse than this actually. Let's flex forward. You see this one? This can lead to like pain in the eye region. So yes. Okay. Jeez, you're doing great, by the way. All right.
Yeah.
All right. I'm going to give that area a break.
Okay.
Now let's take your arm, give yourself like a hug. Okay. So that distracts or takes the scapula more lateral, exposing this region a lot more. So we're going to get this part of the upper trap. And wow, do you hear all that?
Mm-hmm.
That should not be there. That's not healthy.
Oh,
okay.
good.
All that means scar tissue. Yay, abs.
Yay. Doing great.
Okay. Nice. Beautiful. Well, for me, sorry. This is what we want, is what I mean. Okay. All right, let me just get this. And this is nice because we can really get into the hard to reach spaces. These are all designed specifically for the human anatomy. They even have special tools for like horses and stuff. So this is for a reason, so we could really get in there. Okay. Or literally for tennis elbow and stuff, get into these crevices and grooves. Okay. So I do want to kind of, this is where one of the rotator cuffs, your supraspinatus, is. Okay. Good. Awesome. And then, sorry, but I'm going to just expose the front of your shoulder and just get some blood flow in that area. Okay, perfect. All right. I'm going to give this side a break.
Okay.
All right. I'm not going to use the other stuff. You're really going to get red, okay? This is actually deeper into the layers, whereas the IASTM tools are sharper edges, which gets it redder, but it's more superficial. Does that make sense? Okay. All right. Let's go on the other side. Yes, ma'am. Right here, Abby. And this right in here. This left side's definitely worse than the right. Okay.
That's probably being on the phone.
If I were you, I know it's just involuntary at this point, but let's try switching every few phone calls or.
I've got 3 days left there.
That's it?
Yeah. So for the next 3 days.
Oh, that's it, huh? Well, are you going to try to get into the same field or?
I don't know.
We'll see. All right. Ship me some lobster. They're known for lobster crabs? Oh, God.
See, I'm not a seafood person.
Oh,
so.
great. Nice. Yay. All right. Let's put your arm down. Perfect. Okay. And adjusting after this is like my favorite because The muscles are so tired and worn out. We take it to the point of shock. No, well, then when I adjust, there's not as much resistance or guarding or tightness, so it's looser. So I get much better results. Okay, a little forward, please. Perfect. Thank you. Yeah, this side isn't as bad. Just a good thing. Well, your body is naturally not symmetrical, right? Back. There we go. Just push your air. Perfect. Oh boy, found something really nasty in there.
Yeah, it feels hot.
Yeah.
Jeez. Not comfy.
Breathe. Drop your shoulder. Drop. Good. But you see how it's going to all of the. Oh my God. All right, I spoke too soon.
You said this is the better side?
Yeah, that was not good. I just want to know which tool to use. Okay. Yeah, I'm sorry. Jesus.
Ow.
Yep. Jeez. So you're gonna be sore for the next few days. Yep. But like a workout sore. Damn, that thing swole up. I don't know if you had this before, but
what?
No, the before and after. But you could definitely see it's increased in size. So this is all histamine now. You see that? It's not muscle. It's hard to explain. It's like gases. Okay. Perfect. And then let's get your just don't.
Ouch.
I need to.
I don't know if it's the pain or the sound is worse because I can hear it.
You think so?
Yeah.
Is this worse or do you have tattoos?
Yes, but I haven't gotten a tattoo in a long time.
Is this more painful or?
Probably.
All right.
Ow.
Yep. You're gonna call me and thank me Monday.
Okay.
Don't call me in the next. Don't leave a review for the first 3 days. Is
I'll give
what
it a
I
couple
say.
days.
All right, we're gonna just wipe you down, take you to the hill decompression, and we're gonna Y strap, and you're gonna have probably the best result since you came. Okay, good job. Honestly, this will go away by today.
Okay.
Just
as long as it helps the pain, I don't care when the redness goes away.
Oh, she has stretchy skin.
I do have.
We're gonna do skin calf with her. Bro, people love the skin calves, bro. Like,
yeah, there was a girl at work. We were watching your videos. She's like, "I need somebody to do this
I'll
to me."
do
I'm
it.
like, "I got the best one for you."
Oh my God. All right, so you want to come get the whole image from the back? Thank you, Abby. I got you. All right, so this is the normal color of her skin. This is where we Graston, obviously. These are the more injured areas. Well, with her head down all the time, these are tightening up to try to keep this neck erect or straight. So these are being overworked. And this side is because you're going like this and putting your phone. So I call it repetitive micro trauma. It may not be a problem if you do it once or twice, but years and 1,000 times a week, certain movements, you're gonna get scar tissue built up, okay? So give me a second. Let me get Demi to come in, just completely wipe you down, and then we'll get you on the hill, all right? Thank you. My hands are cold. I just washed them, okay? Just gonna check the pelvis. So yeah, it's off, okay. You wanna see something cool? I'm gonna do skin calf actually before we start, so. That just releases pressure between the muscle and the fascia, just gets the blood flowing. It does not adjust the vertebrae like most people think, okay? All right, so we tie the legs. This is a Cox decompression table. Okay. A lot of patients, just lifestyle nowadays, have disc injuries, weakened discs, dried up discs. A lot of jobs are sitting nowadays on the computer. So, our bodies through evolution haven't been designed to stay in these positions for as long as we do nowadays. You ready? You know the drill, right? All right, I'm just gonna contact my structures that I need to. All right, we go down to L5. We're gonna hook her up with like a full spine decompression. All right, here's the first set. Breath in, out. Okay. Is it shooting down your legs? Not yet. Just feeling it. Just what? Okay. So what I'm feeling is for tenderness, and if you do this for as long as I have, you kind of know what a healthy disc space and spinal alignment feels like. Looks like as well, but as a chiropractor, we feel more, okay? Hence why it's very unlikely for me to be up. You feel that? Good. That just popped in to look at where I'm treating or working on. When you get the eyes out of the equation, your other senses heighten up. Give a nice complete stretch there. All right, we're gonna go one more set. You prefer more of an aggressive approach, right? Okay. You could tell here, swollen, tender. Yeah. So you have your paraspinals here, okay? And then this should be a groove right there. But when you get down to this level, you see that groove disappears. It's more of a hill. So that's a tell that there's inflammation in the area, likely due to an aggravated muscle ligament or the disc space. The joint itself isn't moving as intended, causing inflammation in the area. Okay, you ready? Breathe in. All right, we're gonna focus on this one a little more. There we go. This is at L5. This level, if it does start compressing the nerve, the sciatica pain, if you will, initially it starts branching outwards and then goes down the glute. For this S1 nerve, it's all the back of the leg, all the way to the toes, except for the big toe. The big toe is actually L5. Okay. Once we're done with construction, I'll have some posters up again with some diagrams, some referring patterns. Yeah, it's just, if we hang them now, there's still gonna be touch-ups and whatnot. There we go. Good. It's fun because when they're sitting and waiting for me, they look at the posters, they see the diagrams, and they're like, oh, I have this, what's this? And it kind of helps me also diagnosing the patients. You good, Nat? Okay. We're gonna go one more, okay? I don't usually do 3 sets or go aggressive, but Natalia has been a loyal patient of the clinic, so we've kind of established that relationship where we've had enough experience to where we kind of figured out what her body responds best to. The mid spine, the thoracic spine, any nerve issues will start shooting against the ribs pattern. Plus, it innervates a lot of important structures or organs, like the fourth thoracic vertebrae helps innervate the heart, the 10th level innervates the breathing diaphragm, and a lot of our emotions and stress get stored here. So there's been a lot of experiences where, God forbid, a death in the family, or you got a student studying, cramming for finals, so stressed, and then you just adjust this and everything opens up and they start screaming or yelling and releasing all that emotional stress. And I've even had patients within a few seconds of screaming, they actually knock out because their body's so relaxed and needs to rest. So it's, you just don't know when you're going to experience it. You just got to know that it's actually a good response when that happens. I had a patient once sleep for 3 hours and then luckily it was like right before lunchtime. So we let him sleep, but then we got really busy. We needed the room. I went to tap him, wake him up. He's like, "Mom, let me sleep for a few more minutes." I thought he was kidding. He literally didn't know where he was. He was just out, relaxed. All right. We're gonna do the adjusting now. So let's go on this side. Nat, face me. Yeah. Okay. These shoes. I'm surprised you don't have that as much low back pain as you do. All right. All right, give me your hands. We're gonna. Good. Let it go. Let it go. Good. Perfect. Breathe in. All the way up. Good, right there. One more. Good. Other, just on your back. Nice. Good. Question, if I adjust like this, will it muffle the mic?
No.
We're okay? Give yourself a hug. Jeez. Okay, you ready? I'm actually gonna lock you out. Hold on. Relax, relax. Breathe in. All the way out. Drop. Good. Let's see if I can go lower. Out. Oh. There it is. All the way out. Drop right there. Good. Whew. Okay. A lot of those were ribs. Oh, your right side, huh? There we go. One more. Breathe in. All the way out. Oh. A lot of this you can't hear, but just everything just shifted up. It was pretty cool. Yeah. You need a minute? Okay. Yeah, you're gonna sleep very. All right. Let's get these. Do these things, are they that heavy? No, we're okay. Unless you want your toes done. No. Okay. Good. Good. One more. Let it go. Good. Let's go on this side. This side, yeah. Have I done the new way I do, not the Y strap? Yeah. I've done that one. Yeah. You prefer it? Yeah. Okay. Breathe in. All the way up. Jeez. Good. That thing was stuck. Yep. All right, let's go face down. So. Face down? Yeah, let me reassess it. It wasn't your SI, it was more of a sacral rotation. So perfect, yep. So yours wasn't the joints you sit on, this was actually rotated like that. So Let's go face up on your back. He's one of the harder patients to adjust because of his extreme commitment, dedication to, mixed martial arts. His body has gone through a lot of strain. So tight muscles, early onset degeneration. Breathe in, out. Oh. Drop shoulders back. Oh, boy. Okay. Yeah. Out. Drop shoulders back. There it is.
You got it. You got it.
Yeah, he's definitely not good for a chiropractor's confidence because it's just very hard to get an audible. But just because it doesn't pop or you don't hear a pop doesn't mean the joint didn't move. So an adjustment, we just mobilized the joint, which we did get. We achieved it. All right. Nice shoes, buddy.
Thanks, bud.
I thought they were the original Yeezys at first. Cole Hans?
Yes, sir.
One of those comfortable shoes. Oh yeah, right now. Oh, that's good. Yeah. Let's get the hands. Yeah. Nice. Alright, let's go on your side, face me. Relax your back. Good. Out. Okay. Let's scoot down. Breathe in. Out. So I like to stretch a little bit before I deliver the thrust. Just to get a feel. Allow blood to flow. Ligaments to stretch a little bit. Get the patient more relaxed and familiar with what I'm doing.
Oh, my favorite. Yeah, this is it.
Adjustment's so good it took your breath away. Oh, John.
Oh, bro, excellent.
I felt a few of them go, man.
Dude, few?
Yeah.
How about in the morning?
Yeah, good. You need it, bro. You definitely need it. Okay, time to pull your ears.
Oh, yeah.
Muffin, that's.
Oh,
yeah, let's sit here.
I'm surprised you didn't forget.
No, I've been waiting. You know, when or it's Christmas or you're going to Disneyland, you wake up like, oh my God, I'm going to this. I'm like, oh my God, Roman's coming today, I'm going to pull his ears. All these years for the roofie jokes.
What is this doodle? Owl.
Oh.
Ew.
Yeah.
Dude.
It's actually
What's wrong with you?
So,
I mean, I got big ears, but
eardrum, right? It's made out of 3 bones, so there's like the malleus, incus, and stapes, so they're joints. So if it's a joint, we can adjust it. So what we're doing is actually pulling on it, and if it does pop, you're getting movement of the joint. So I've helped improve or treat patients' symptoms of like ringing in the ears. We call it tinnitus and stuff like that. Patients with like lightheadedness or like somewhat even vertigo, it helps because your balance actually comes through your ears. So we have the cerebellum part of your brain, which is responsible for where you are in space and your balance, right? So the sensors come through the ears. So when the joint or the eardrum isn't moving, that can create symptoms of headaches or ringing in the ears or imbalance issues. So, your body is designed to treat itself in so many ways we don't even consider. Oh yeah. Cauliflower ears.
Broken ear.
Yeah. I heard like some people actually get them broken on purpose to like look
Really?
like fires. You ready, baby?
great. That was great.
You want to hear my punchline?
Mm-hmm.
You ready?
Yeah.
Unleash the Kraken.
Drop your shoulder.
For us to get those 4 pops on this guy's leg is
Oh,
a big
dude.
deal.
That
A
was
big
good.
deal.
Thank you, bro.
You like to unleash the Kraken?
I love it.
Yeah.
That's
And I'm
good.
making shirts. Licensed crack dealer. Comment what you guys think. Yes, no. Give me
Come
some
see
ideas.
this guy.
Yeah. Thank you.
Come see this guy over here.
Thank you, brother. Always a pleasure. Merry Christmas. Happy New Year.
Merry Christmas and Happy New Year. God bless.
Of course. All right. Everyone's busy treating patients, so I'm gonna go ahead and actually do some manual trigger point therapy. All right. So what I'm trying to do is palpate and locate the actual trigger points. Okay. Which, oh, there we go. All right. Just lean back for me. So when I push down, I'm trying to recreate the pattern of the headache. All right. I'm pretty pushing, or are you feeling it somewhere else?
Pain when you're pushing.
Okay, so for this, we're not looking for that. We're looking for referred pain. So how's that one?
That's kind of going to the eye.
To the eye. Okay. What we do here is we just apply pressure and don't let go, because it's trying to push back, and you push it long enough where it gets tired and kind of melts away. All right, just relax the shoulder, relax it. Let it go down. Okay. Has it decreased at all?
Yep. Wow.
Yep, there it is. Okay, so now that was the trap. So next one that's common for that area for the headache is the levator scap. More commonly the insertion. There it is. All right. So, ooh, okay. Where were you feeling that one?
Just going to up a little.
Just to there. Okay. Breathe, breathe, breathe. How's that one?
I feel like that's the one.
That's the one?
Yeah.
Let me get a good contact for this one, John. Just shake the chest, okay? This one, right? Okay, there it is. Breathe. Yeah, you do need a lot of forearm strength and stamina. But doing this for over a decade now. That's it right there. Yep. It's not pleasant, but for me, it's gonna be tender and uncomfortable and painful. Might as well just go a little aggressive and get it resolved in like 1 or 2 visits. Saves the patient time, money. Ooh, yeah. Okay, that right there. Breathe. Okay, and then slowly this pain will decrease. Then we will start pushing harder on that spot until the pain is no longer there. Yep. Do you get it only on the left side or the right
I
side?
get it all on my left. If you remember, I had broken my humerus,
Okay.
so this shoulder always has more.
Has issues,
yeah.
okay. And it's this spot, okay? And sometimes it is a good idea to go in with the elbow, okay? Just to save my joints. Yeah.
Ow.
It's yeah. Okay. Breathe, good. Is that shooting to the eye?
Yeah, it's going to the.
Can you just show the pattern that it's going
So
into?
it's going up to the neck and then going around to like the
Again. Yeah. There it is. So when I tell you that the body is a map and every area has like a segment, a level, a muscle, organs, this is one of the diagnoses that actually draws it up for us. Okay, how's that? You okay?
Yeah.
Is it to the eye still or?
Now it's going a little bit like halfway here probably, and then that one.
As it gets better, now we're reversing it. It's going from the furthest point back to the origin.
Of this one.
Yeah, that's it right there.
Oh, that one is.
Yep. Yo. Breathe out. Gonna give her a break as well as myself. Probably start on the other side and then come back to it.